So as we age, we start to lose space between the shoulder girdle, or rib cage, and the pelvic girdle. Why? The intervertebral disc, big old lumbar intervertebral discs, start to become more compressed because we lose our anti-gravity spring system, too much sitting, all the things that you already know about. So when we start to lose space in here, particularly in the elderly can get to a point so that these ribs drop all the way down and touch the crest of the ilium. That's called kissing rib syndrome. And it is really painful. All the symptoms are, as soon as they side bend to that side, it hurts on that side locally. She's got a lot of space here, so we don't have to worry about that. But the whole goal of this routine here is that we're going to create space. All of your clients need to have more space between the shoulder girdle and the pelvic girdle. And people do not like to work side lying and open this up. We work the front, we work the back, but we don't really focus on opening this up, taking pressure off those intervertebral discs and helping our people with low back pain, lumbar disc pathology. This is one of my favorite techniques. I use this for years and years and years, digging in the low back. I love to dig with my elbow, slowly dig with my elbow, and this is the position I have them in. Knees flexed to 90 degrees, arm over the table, and I'll show you why in a minute, so that she's nice and spread open right here, right? That's the position you get them in. Then I'm going to sit on the table, and you don't have to do this, but I like to come over with my hand in the back because I'm always trying to get a counter force. So what I do is I lean back like this. Notice how I'm leaning against my own arm? Starting to decompress that hip, pull that hip down so that when I come in with this elbow here, make sure you guys can see this, we're going to come as close to the lumbar spine as possible and as close to the ilium. There's a little sweet spot in there that we want to get into. And I want to just hold on that sweet spot for a second. To help me with that, I want her to just very slowly and very small movements of pelvic tilting. So just go with a little pelvic tilting forward and back, perfect, just little bitty movements. And I'm kind of following her with those movements. My elbow is not moving, it's buried right there. So I just kind of hang out here for a minute until I feel like I've got some sort of hook. And stop. Now I want her to pull up on the therapy table against the resistance, and I'm dragging back here, she's pulling up there, and you can see what it's doing. It's really pulling the rib cage away from the pelvic girdle while I'm still buried in here in the low back. I can dig in the low back, I can come up to affect quadratus lumborum. You're really not contacting quadratus lumborum, but you're opening up all of those things that can be compressing, pulling the shoulder girdle, rib cage too close together. So up again, pull up on the therapy table and pelvic tilt at the same time. Aha, a little tricky there. Jolene knows how to do that. Very, very, very good movement there, dear. All right. You guys got to do this technique. If you're not doing it for your low back people, you're missing out because it's really, really powerful. It gates the large diameter mechanoreceptors in the low back and really helps with the low back pain. So not only are you separating here, getting a lot of separation here, but you're also helping with the low back pain. Here's one that you've seen before, but I am going to do it again. It's a QL stretch off the table. Notice how now I have her long legs off the table, so we got a mechanical advantage going on there. I'm going to come in, get my body weight really low. Right hand comes over and webs along the crest. Other hand comes here, and here's the key. When you get down in this position, grasp here. Both arms, grasp. Now you drag, I get my chest right up against her hip, but if breast tissue is an issue, use a pillow or don't put your breast against the buttocks. All right, so I'm getting down here, getting comfortable. Now I'm going to ask her to pull up on the therapy table. 2, 3, 4, 5, and relax. And now I'm just pulling it down. Pull up, 2, 3, 4, 5, and relax. I'm going to come up a little bit and slide into it. Pull up and relax. Can you see how that's opening that all up? Powerful, powerful technique for creating space. It's what it's all about, creating space, getting the length again, taking pressure off those intervertebral discs.